Good evening, and it's great to have you with us here on a Tuesday night. And we begin tonight with the coronavirus and the alarming new numbers. Cases on the rise now in every state. And tonight, November is now already the worst month for the virus since this pandemic began. More than 2 million new cases this month alone, already a record, with, of course, 2 weeks to go. And, of course, Thanksgiving also nearing. There's also news tonight from Pfizer, what the CEO said about emergency authorization now. And once that happens, saying the first shipments would be out within hours here in the U.S. Hospitalizations rising in 49 of 50 states now. More than 73,000 Americans in the hospital fighting this virus. More than 248,000 lives have now been lost. And tonight, the heartbreaking stories emerging from doctors and nurses on the front lines. They're the ones seeing this, fighting this, and many say they're now at a breaking point. Tonight, more states imposing restrictions. Just today, new curfews in Ohio and Maryland now. And the governor of Iowa tonight, who railed against masks, calling them a feel-good measure, now mandating masks in her state. And the long lines for testing are now back. With the holiday approaching, these images from Los Angeles tonight repeated across the country. And another image we have not seen in months, some grocery stores with empty shelves now, supermarkets limiting what you can buy again. It is a lot tonight. We'll carefully take you through it all, and we begin with ABC's chief national correspondent, Matt Gutman, reporting from Oklahoma tonight.
Tonight in hospitals across the country, like this one in Lawton, Oklahoma, they're running out of beds and equipment, but the patients keep coming. How far do you think you are from the breaking point?
We've had a day last week where we were down to one ventilator. We had a day this weekend where we had to pull the ventilator out of an ambulance and put someone on a transport ventilator.
Tonight, more Americans hospitalized than ever with COVID, over 73,000, and the cavalry isn't coming.
Everyone in the whole country is dealing with this, and we have no help. We have no support.
Behind that snarl of tubes, Curtis Sims is fighting for his life. He first felt ill on Halloween. One floor down, we met his wife of 37 years, Suzanne.
His chest will rise, and then he'll get like one little syllable out of there or something. And so you're trying to help him by saying the word for him, and then he gets frustrated if it's not what he wants to say.
And when she dropped him off at the hospital 10 days ago, she realized she might never see him again.
You just go to the parking lot and sit and cry.
With his condition deteriorating, doctors put him on a ventilator 2 nights ago. So the hospital has started to allow some visitors to visit loved ones. And they told us that they would actually allow you to get into PPE and be able to see your husband, Curtis. If that's okay with you.
Yes, it would be great.
Down the hallway and up the stairs to the ICU, we suited up in full PPE before going inside Curtis's room.
I love you. I can't believe I actually got to come see you.
Tenderly stroking his arm.
You keep fighting. You got this.
We left them alone. This hospital is at over 100% capacity.
The problem is everywhere else is full. So when someone comes in the hospital and they need ICU care, there's nowhere to send them.
What happens if a bus crashes on the interstate and there are a whole bunch of people who need intensive care?
Then you see all these people that are doing the groundwork. They do more. That's all you can do.
This is what keeps you up at night.
I'm not sleeping very well these days.
It's happening everywhere. This nurse in Nebraska, exhausted.
We have, I think they said 10 COVID units, and one of those is just a place for people to go and pass away, unfortunately.
Nurses outside Philadelphia walking off the job today, saying they're not equipped to face this surge. In battered El Paso, where jail inmates are being deployed to load bodies into morgue trucks, nurse Ashley Bartholomew quit when she reached a breaking point. One of her patients comparing COVID to the flu.
You just feel defeated. Am I making a difference anymore? Because I'm here, and here's this patient who's in the ICU and is still clearly confused on how real COVID is.
And so let's get to Matt Gutman with us live tonight from Oklahoma. And Matt, we know vaccine maker Pfizer announcing it is now ready, that they have met the requirements, they say, to now ask for emergency use authorization for its vaccine.
It's an important milestone, David. Pfizer now announcing that it has all the necessary safety data to begin that application for emergency use from the FDA. It says it could even file that application in a number of days. Now, the FDA says it might need about 2 to 4 weeks to actually get that approval in the can. Now, Pfizer has been working on its distribution plan. It's got a pilot program with 4 states across the country, and the company says as soon as it gets that approval, it could begin shipping out those precious vials that very night. David.
There is some hope ahead of us, Matt. Thank you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.